Welcome, everybody, to Stuck at Home Youth Mental Health and Education During the Pandemic. As you heard just a minute ago, this meeting is being recorded. Please note that by participating, you are agreeing to have your photo, voice, reactions, and questions in the recording. A copy of it will be on our Facebook page and our YouTube channel. Audio from today will be edited and published as an episode of the Bell podcast probably next week. Webinar reminders, we just like to remind folks to mute yourself during the presentation to prevent background noise from being disruptive. Turn off video if you're going to be moving around. No one needs to get dizzy, including you. Please submit questions through the chat box. We will have some opening moments, though, where you're allowed to unmute and ask questions as well. But we will try to add them either at the end or as it seems natural to do that. So. These are difficult topics in general that we're covering on all of these webinars. So we want to make sure that folks know if they are triggered, it's okay to step away from the content. You matter, your mental health matters to us. There's no shame in having to step away and return at a later time of any of our conversations. The recordings will be available. You won't miss anything. If you feel yourself in need of crisis assistance, please call the 800-273-TALK or text MHA to 741-741. And there are also additional local crisis lines available at Get Help. This particular topic is probably not as likely to create those problems, but we just like to have that information always available. So Dr. Cruser, thank you for joining us. Do you want to introduce yourself a little bit?
Sure. Hi, I'm Dr. Cruser. I'm a child psychiatrist, child adolescent psychiatrist working here in Lexington. I grew up in Knoxville, did med school in Tennessee, and I did residency at UK. I worked for a while in Moorhead, and I've been working with KBC Behavioral Health for about the past 6 years or so. And that's kind of it in a nutshell.
Mm-hmm. Well, thank you for being with us today. Did you want me to ask questions first, or did you want to just start in with some of the stuff that you know that you wanted to present?
Actually, I was going to go at it kind of flexible. There's so much. You're talking about having anxiety with setting up any of these meeting stuff, and I'm thinking to myself, okay, well, just the scope and the importance of the topic is pretty overwhelming, and the data literally changes every day. In fact, in the past week, there's been updates on when someone can get reinfected for the virus, and then in the last 24 hours, changes in how to approach testing and other stuff. So yeah, it's a lot. So anyway, I'm just kind of keeping it flexible, and I looked up a lot of stuff, had some ideas, and I'll just kind of go with the flow on how you want to go with that.
Well, the first question we get a lot is from teachers and parents both is, what should they be worried about with kids during COVID-19? It's a big question. It's a bright one. And I think there's probably some symptoms and some situations that you've seen as a provider that would help us kind of know that this is the moment to have a little special conversation with our kids.
Okay, things to look out for. There's the medical end of stuff. Watch for the fever, the cough, fatigue, loss of taste and smell, things like that. For the illness stuff, in terms of development and that sort of thing. You're with a major crisis like this, you're going to see some common reactions for both adults and kids as a part of a stress reaction. And some of these things are to be expected. And then there's also situations where you need to make sure you're seeking additional help. Some common stuff, it kind of varies a little on the age. Looking at with adults, by the way, you're going to see like some more stress, adapting to changes in situations, whether it's they're not able to work, now they're suddenly becoming de facto teachers, worried about caregivers or other relatives that are ill and such. And then for the adults, they'll have symptoms often of like feeling like overwhelmed feelings, anxiety, irritability to go with it, affects your sleep, physical symptoms. I read a study about how those have increased. And I think actually Dr. Agrawal mentioned part of that in her presentation. Suicidality goes up and such. Anyway, there's a lot of things that the parents are experiencing. The kids go down to like, infant and preschool stuff. I mean, you'll see irritability. I hear parents complaining of the kids whining more often, more wanting to be held or cuddled. The sleep will be off for them. Sometimes their feeding and appetite will be off, and you'll see some aggressive stuff. Like I've heard more cases of kids resuming bedwetting and that sort of thing. When you get into school age kids, there's a lot more. There can be more irritability. I tell the parents it's kind of like a lot of them come in with the chief complaint of like, my child has anger problems or agitation, and sometimes I can find different causes for it, and then a lot of it comes from anxiety. When you can't control the things around you, it gets really frustrating. When you get frustrated, you get agitated, and then they end up reacting that way. But they can also get very clingy. They can change their activity level. They can have nightmares. They'll talk about being afraid of being alone. Get preoccupied with talking about it excessively. I've had a few of those come through. And a similarly kind of aggressive baby talk happens sometimes. For adolescents, I mean, you see some of that stuff, but also some more conflict, arguments, ruminating. They can have more physical complaints also. Sometimes they'll have some more risk-taking behaviors, or some of them I've heard several adolescents talk about being afraid to leave the house because of all the stuff going on around them, and they may have difficulty. Adolescents, they have this kind of fuzzy area between adulthood and childhood, and they've learned a lot of the verbal capabilities, but they still don't have some of the extensive processing for adults. So they may be trying to communicate, just have a hard time reaching that, and that can lead to some frustration there too. Those are to be expected to some extent there. Yeah, I would watch out for cases where you may need more help. For example, if you're having dangerous thoughts or dangerous situations come up, if they're unable to stop worrying or crying, or the kids stop playing. I mean, they should be able to play even despite some of this stuff. They'll too overwhelmed, and that kind of thing. So that's some stuff that I'd watch out for.
That's awesome. Thanks. We had talked about kind of just in general how going back to school is really stressful on a regular basis, right? And how do you think it's going with COVID-19? Are there things that we need to do for ourselves and our kids to help with the stress?
Oh boy. I excuse the language, but I think it's sort of a damned if you do, damned if you don't situation. There's with the COVID stuff, I mean, going to school, there's the physical risk of transferring the virus to other caregivers or relatives who have significant physical illness, predisposing things that can cause more complications of the illness. It can be passed on to the teachers, and then they get pulled out of play. You have to watch for that. There can be the increased stress on the medical system when they're back in school, and also the kids that are worried about the virus. That tends to go up a little bit there. Now, when they're the folks that are at home, having to do all the instruction at home, it's also difficult with the situations of, I mean, the parents are stressed. Again, they're becoming the de facto teacher for some of these, or acting as a teacher in a way. They've got their own stressors they're trying to deal with, and then they've got to be able to have those under control while they're trying to manage kids and their responsibilities. The kids suffer from changes in the routine, from missing the social stuff. I've got folks with underlying mental health conditions. ADHD folks are getting more restless and stuff, and they need to get their outlet for that. Those with defiant disorders are pushing back a little bit more sometimes. The anxiety stuff, of course. Autism has actually been a big one. They have changes in routines that are difficult, and they're losing opportunities for social skills development. A normal developmental stage for adolescents, I mean, you talked about people learning how to walk and talk and stuff. Adolescence is all about developing peer interaction, peer relationships, and that's been, essentially cut off, at least in a physical sense, in terms of in-person interactions due to this learning at home stuff. So that's stressful for them, and then working with them to try to find other ways to help with them at that. So there's a lot of ways that a lot of complications, whether they're at school or whether they're getting the education at home right now.
So you said you had some new stats. Do you want to go ahead and share those with us about like where things are and what we know statistically and medically about COVID-19 and kids?
A little bit. Let's see. Last I saw, well, of course, most of us have heard that the adults are higher risk than the children are. The latest information from the World Health Organization is they're saying that children 5 and under have a significantly lower risk of transmitting the virus, let alone symptoms. So they're actually starting to suggest allowing without masks around age 5. But the standing recommendation from the CDC, I believe, is age 2 and up if possible. So there's a little fuzzy stuff there. I was seeing an article from the Lancet in Great Britain about the global number of pediatric cases are roughly 2 to 8% of all COVID positive cases. Although I also heard in the news that there was a 21% increase in pediatric cases just within the past 2 weeks. So there's a little bit there. There's one of the other complications. While kids are not as likely to get severely ill, it can still happen. I was trying to find the exact incidence number for this, but there's this multi-system inflammatory syndrome, which is pretty uncommon. I can't find the exact number on it, but that one has like inflammation throughout. I think 80% have 4 organ systems involved and cardiac stuff and that sort of thing. So they can get really, really sick. And there have been some fatalities even in Kentucky with this. But I've seen that a little bit of something to watch for, although luckily there's not too many of the cases from what I understand so far. Something else that's new, early on, I had a colleague who was pregnant. I was like, well, hey, the good news is we haven't seen any data yet on impacting pregnancy. And then just within the last 24 hours, reading about the CDC saying we may want to be cautious of that situation, there may be a little bit more data on that. One of the things that has been real frustrating for everybody and also policymakers but it's also the positive thing of science. Science keeps changing. This thing is insanely new, and we have some initial impressions, but then as we get more and more data, we're like, okay, that impression was off a little. Here's how it's looking like at this point. And the stuff that I'm telling you now with the spread of the illness sort of stuff is going to change it even further probably as we get more and more information about it. So just there's a lot of you're seeing science in action. Multiple studies, some studies contradict, and then over time you see a consensus on like which ones, what are the usual trends and what do you see as being most consistent there. So yeah, there's a lot of data that's being changed regularly here.
Are we seeing much in psychiatry or psychology if you've run into any of those while you were researching for today? I know it's coming out kind of more new information or new science on that kind of aspect because of COVID-19. Have you seen much yet?
New, you mean
new science, new data, new information?
Let's see. There have been some cognitive effects from the illness that I've heard a little bit about. Mm-hmm. It does seem to affect some neuronal stuff, I believe. And then there's the folks that get like really sick if they're in the ICU, ventilator level stuff. I mean, one of the complications for anyone with that level of severe illness and treatment, I mean, they can have sort of get delirium symptoms. It's a psychiatric thing, and have a hard time with some concentration and stuff after that. And in fact, mood stuff as well. Otherwise, it's a lot of what I'm hearing generally is more secondary stuff because of the impact of the illness on the individual or the family, or because of the fear that goes with it, that kind of thing. We're starting to see that having a lot more impact on mood disorder symptoms, anxiety, the with kids, ADHD stuff, substance use disorders. I think I've looked up a number. It's roughly was it a 200+% increase in alcohol purchases, I think, from a Nielsen study.
Yep.
So, I mean, there's a lot of folks that need their substance use treatment program, and luckily the federal government has relaxed some treatment restrictions to allow medication-assisted treatment for substance use disorders, and it with a little more of a flexible with a distance treatment as opposed to in person. But that's because that area has also been going up. There's been like I said, the suicide stuff going on, and in terms of with that, the data I've heard of is more specifically with the increase in calls to suicide hotlines has gone up sharply. So that's another one that we've been worried about. In terms of psychologically, also safety issues. We've got for kids with people worry about like child abuse stuff. The schools or the teachers, some of the most prominent reporters of stuff. If they're not at school, it's harder to recognize. And we also have the tense parents with their situations and the headbutting and stuff. So that's something else that's a little bit of a concern. But it's sort of like making sure you're able to meet your own needs, so something doesn't get to that level. Is very helpful, and you're making sure you can contact someone through the domestic violence hotline and other child abuse hotline as well. But that sort of thing, it's hard to tell with some of the video encounters I'm having what exactly is going on in the background, because it's a little harder to get some privacy sometimes with the kids that way.
Yeah, we've heard about that concern from a lot of our public school folks as well, is that there's a concern about those lost children, the folks that aren't able to enter services and such. Yeah, I don't know that we have answers for all of that, though. These are just disparities that already existed that are being exacerbated by COVID-19. Is that fair?
Oh, totally, yeah. It's been there. Kentucky's had like a significant, compared to other parts of the country, higher risk of like child abuse. And on the flip side, if they were out in the community, with a higher risk of spreading illness, I mean, we also are one of the highest states in the country in regards to kids living with grandparents, and they're certainly at higher risk with medical conditions and age and such. That, on the other hand, if we opened up everything, that could be a problem. We have a lot of kids losing their primary caregivers.
Very real concern. Yep. We had a question come in from Angela. She's in Clark County. She said, social interaction is limited. We know it's highly important for people of all ages. She was wondering if you have some tips for people to cope with limited interaction, with having limited interaction.
It's a good question. And again, especially I'm thinking about the kids stuff, with the adolescents particularly, but I mean, with adults, I mean, also you've got to get support, just someone to talk with. Things that can help stay in touch, certainly with family members. For the adults, they may have concerns about, is Aunt Jane doing well, or that sort of thing, and they can experience some reassurance with that. These forums like this one, where you have like groups getting together, are good. Phone calls good. Distance with your neighbor can be a little bit helpful there. With the kids, I mean, the younger ones especially, we love to have the live interaction stuff. I've seen some talk recently about pods, which when I hear it used in that term, it's usually more in terms of educational groups with a mentor sort of thing. In the clinic, I'm hearing situations where families that are like in close proximity and the kids played a lot together, they kind of limit their interactions, but they allow them to interact with like this particular neighbor that they're with a lot, and then they just try to make sure they don't have any others going on. So that helps some. Well, I don't want kids to spend all their time on video games and spend all their time on a screen. They still got to get physical exercise and sleep and social family time. But also these days, we're lucky to have this communication medium. I've heard adolescents sometimes talking with friends on during their video games, or having chat activities going on. if there's any concern about what's going on with that situation. I mean, if there's been a history of the child having some inappropriate interactions, especially then, it's important to make sure that online communication is something that the parent can get, check in on from time to time and make sure that's appropriate and all that stuff. But that is a very useful tool these days that can help out a lot too. Other stuff, I read something about one of the interventions that can help is these kids that don't feel like they can do much, that they're, all the stuff's going on, what can I do kind of thing. One of the tips I was hearing about was actually writing letters to family members, which also is a way that parents can help build their grammar and writing skills. But they can communicate that way. They can also leave, if they want to do something good for people, they can also leave like a "How are you doing" note to slide underneath their elderly neighbor's door, stuff like that, in terms of like communicating with community stuff a little bit. Just some ideas.
Yeah, that giving back piece is something that we have in our back to school toolkit that was just released this week, and that I don't think you've had a chance to look at because I barely have. So it was just done from National MHA, and we'll be putting that out with the link to everyone after this, just so folks know.
And that's another thing. There's tons of online resources. I mean, in terms of communication, over the past 3 or 4 months, I've seen a boom in like resource of whether it's through the American Academy of Child Medicine Psychiatry, the Center for the Study of Trauma and Stress, and others where they have like recommendations on how parents can like handle these situations and what to look for. So yeah, and then again, I haven't looked at the new MHA stuff, but I'm positive that this is very useful in there.
And you've covered a lot of it actually. So there's that interactive piece, as much as we can encourage it amongst kids of all ages, the best. So forgive me if folks are hearing any of my background noise here. Homeschooling is fun.
Yeah.
At MHA, we have seen an increase by almost 7-fold about in mental health screenings being taken by folks voluntarily, including our parent screenings. I was wondering if you're seeing an increase in people interested in getting mental health help because of COVID-19 or since it's been started, if you guys have seen an increase in intake calls, etc.
I have to admit, I would have to check with the intake office to hear their details from there. I have heard that they're staying pretty steady. What I'm gathering behind the scenes is I think early on when they closed the offices physically, I think a lot of people were pulling back on seeking help. I think that as folks have realized that there is still care available through the telehealth or telemedicine interactions, it's picked back up. For myself, I've noticed within the last 2 weeks a huge increase in new evaluations. Which leads me to think that the number of people seeking help is increasing, but I don't have any exact numbers on that yet.
Of course, you're one provider at one place that also is going to be a little limited and qualified, but it's good to hear from a provider that we're seeing more new evaluations in some ways, because obviously there's something going on that people feel the need to seek treatment for. So I think that's important that we're starting to get past some of those old stigmas. I think we are having a more obvious conversation about mental health as a state. And I think Governor Beshear mentioning it many times in the very beginning of COVID has been helpful for folks to realize that. So,
hey, one little kind of trivia piece. I don't know. I was looking up, I've got a text on disaster psychiatry and in terms of like, interventions that can help with that. They were talking about like things you can do. And for what it's worth, one of the specific details I read about was about keeping people connected and engaged, and specifically the quote that's in the book is "We're in this together," and it's like it's just exactly what I doubt he actually read the textbook, but intuitively it sounds like he's saying the right stuff that we need as a state to keep in touch with each other and try to like maintain positively and hope, which is good for adults and for kids.
Right. The more we see this as a community issue and a community effort, I think that does help. You're right, and that's kind of what that is, right? So we're all here together. We're all going through this. It's not just you, and it's okay to have real conversations with real people about what's going on. So it's
That's
always
important.
helpful.
That's important for the adults and the kids. I mean, everybody, they don't want to feel hopeless or helpless. And that can happen in some of these situations, especially if you're disconnected, you're not socially interacting in some form. I hate the whole term social distancing, by the way. I like physical distancing, but everybody, especially with this medium, you can have some social interaction there. But for adults, you don't want to feel like hopeless or helpless, and having the interactions good. With kids, obviously they don't have the same potential for doing stuff that the adults can, but letting them know things they can do, and reassuring them, like the one thing we mentioned with the whole the letter to relatives thing, or some folks are like drawing pictures that are actually showing up on governor's press conferences, things to kind of brighten people up a little bit, but making sure that they know other things they can do instead of feeling helpless or whatever. Like, look, you are actually doing something good for the community by staying home and preventing the spread of the illness. I mean, if they know that by doing that, they're doing something good, that'll help them feel a little reassured and not as helpless. Make sure they know the importance of the washing the hands thing, the mask thing, and then that way they'll realize I'm actually doing something good for folks, and it'll give them a little bit of, less stress about that.
It's true. It gives them ownership of something to do. We all need something to do, right?
Oh, yeah.
Is there anything I haven't asked that you wanted to make sure that we talk about today?
I was trying to think of some things for the other stuff that the families can do and how to handle the school situations. Let's see. Parents, definitely please meet your own basic needs. You're gonna need rest. You're gonna need exercise. The rest so you can handle the stress of handling 3 kids with different grade level teaching stuff, and they're getting frustrated. You've got to get some rest for that. You've got to get some exercise to kind of get the blood flow to your brain to process all this stuff, and it's good for endorphins and moods, helping your mood. The parents need to be informed, stay in touch with also being able to contact the schools, know how to reach the teachers, but also turn off the news if you're feeling overwhelmed. And the kids, they've got to have their own basic needs met. Like I said, exercise, healthy eating, love and support, medical care when they need it. They need the reassurance. They're a lot of times at this age, they'll assume that things are caused because of themselves. And the younger kids, it's like, well, this all happened. Uncle Johnny got sick because he came to my party 4 months ago. And it's like, well, it probably wasn't. You're just kind of giving them some reassurance, because they assume a little there. Make sure that they know that there are people out there helping. Mr. Rogers famously advised children to look for the helpers and let them know that there are people making a difference to help them with that. A big one is routines. Kids thrive with routine. It's harder to do sometimes, especially during the summer, which we're slipping out a little bit. But making sure they know with school, having a period of time where you're going to be doing your education stuff, make sure you have routine for when you're going to go to bed at night, some meals together, some downtime activity, and that helps a little bit, helps a lot there, because you can also get in the right mindset with stuff. And regarding school, let's see, stay in touch with the school, especially for tech support issues. A lot of the public school websites have like connections to here's how you reach tech support. Sometimes they'll have information on food programs, or they'll know about how to get access to a hotspot, because that internet connection can be really big. And they'll know more once the schools are getting back to in-person stuff. If you keep an eye on the school sites, they'll let you know when something has to switch out, if like cases are coming up again. Let's see, and be aware that the kids, they don't verbalize as well as the adults when they're stressed. They're going to act out, which can get kind of frustrating. But just be patient with them, recognize that happens, and give them a chance to speak up. Give them a chance to express their frustration. Say, okay, you're worried, you're afraid of this. That's all right. It's going to happen, and give them some reassurance, and definitely do your best. These parents, all of us, there are a few of us that are teachers, but not most of us. Not in like the traditional trained sense. So don't expect to be perfect. I mean, I've seen some parents beat themselves up about, I can't do this. I haven't been a teacher. I don't know how they're doing this math thing. Okay, true, but do your best, and whatever guidance support you can get, give to the kids is helpful. And when you need some extra help, call in some reinforcement ideas from the teachers there.
It's a good thing. I think it's been interesting to see how we've all had to turn into self-advocates in some ways with technology and teaching and asking our kids, what's really going on, right? We're having more conversations, more real ones, I think, as families. So it's really important. Are there any questions from anyone who's still with us today? Feel free to unmute yourself and ask a question if you got any for Dr. Cruser. Or feel free to put one in the chat as well, especially if you have multiple things going on in the background like I do. So, alrighty. Dr. Cruser, one question I should always ask whenever we do these with providers is, when should people seek help, do you think? When should people be coming to you?
Well, I mean, there's a little bit of stuff we mentioned about, like, if someone is, people are getting hurt. I mean, that's definitely a red flag. I mean, it could be whether, kids will have some fights with each other, but if it's persistent and there's some significant injuries going on, I mean, that's certainly a case. If they're actually hurting themselves, that's certainly a case. If they're doing a lot of risky stuff, if they're trying to be out all night, there was one I saw that early in the pandemic was out all night with friends, despite the parents getting involved, and there was some even legal stuff that went along with it. That person really needed some help. If they cannot stop their stress or their worry or enough to actually enjoy some positive stuff, that's a little concern that they may need some help there. And you want kids to be able to function. That's one of the big things I look for is the patient functioning? I mean, everybody, I mean, I've been stressed about some stuff. Everybody here has some anxiety and some stress, but they can still bring it down and they can function, and have some good moments and things like that. If that goes away, I mean, that's a flag. And also with the parents, if you're feeling so overwhelmed by the situations, and there's other stressors. I mean, there's job, there's housing, there's your loved ones and such. If you're so overwhelmed that you can't apply the things that help you calm down, be sure to ask for help for yourself, because one, that's a good model for the kids of knowing it's okay to ask for help, and two, they might learn from the coping skills. Plus, another thing, it might keep you from doing something you regret. There are some folks that get so overwhelmed and agitated that they may be at higher risk of, like, trying to do something accidentally hurts the kid. So you don't want that to happen. If it gets pretty bad, talk to someone beforehand. And I think that would be pretty helpful.
Thank you. Any other questions come up from folks? Do you have any recommendations or for the parent of a child just with autism, mood, or ADHD transitions during the virtual learning day? So that's a hard one. So somebody who has a lot of complicated issues during the virtual learning.
Okay. That is really tough. And there's a group home I work with a number of kids with developmental disorders, and I'm like, that's tough. These folks with, especially, everybody gets a little stressed by the change in the routine. Autism, Asperger's, that sort of stuff, that can be even more stressful. That's tough. With these situations, regarding education, I would stay close contact with the teachers, also special education staff. I've been hearing about some families, they're still getting speech therapy and even some occupational therapy through the video. While I would love for it to be in person, they're still being able to get some help for these things. I think that's important. For autistic disorders, know what soothes your child. This is one of the great things about working with parents. I can suggest, here's this therapy that can help, here's a medicine that might help a little bit here, this sort of stuff. But the parents, they know their kids well in terms of, okay, he calms down when I hold his head like this. He calms down if he's got this in his hand to soothe him. Know those and have that stuff ready. And for the other stuff, for ADHD, for example, I mean, this works for other kids, but especially ADHD, make sure you get some physical activity time. Work that into the schedule regularly. Research studies show that actually some ADHD symptoms can improve with an intervention of only getting adequate exercise. So get some physical outside time. Also, with the virus thing, I mean, ultraviolet light's not good for the virus staying alive, so that's a perk. But that physical activity is good, and there's even studies for, I mean, looking at adults for sunlight actually being therapeutic for depression symptoms. So there's multiple reasons, especially for these ADHD kids, to kind of get the activity going on. For the depression stuff, you might even, the anxiety especially, both of those. If they're already in treatment, they may already have some coping skills, some relaxations that they've been taught, reminding them about it. One thing I'll often suggest is in the evenings, I'll suggest to the parent, okay, you're trying to get your kid to wind down to fall asleep at night and regular routine. As part of the wind down time, I mean, have them sit on the bed, you might do a back scratch or story. You could also practice the relaxation technique at that time, whether it's a deep breathing, imagining a place, prayers. Some people read the Bible together too. Whatever it is that helps your child relax, practice it in the evening. And in cases where it works well, great, they might wind down a little bit. Also, there's this positive psychological association of soothing time with mommy, daddy, doing an activity, which can also maybe translate into extra soothing feeling when they try that activity at other times of the day when they need it. So that sort of practice can also help a little there too for those things.
That was awesome. Thank you. Yeah. And I think for the parents of those kids, I would say also don't have the same expectations, right?
Yeah.
Take a break, give yourself a break. I've personally met a lot of parents who are very type A and very concerned about their kids and falling behind. And I'm like, we're all going to fall behind. Is that completely bad advice? Like,
well, also one thing I was looking at here was reminding folks that some kids are worried about falling behind in their education. Kids are even worried about this. But reassure them, okay, this is not an ideal situation, but you're in the same shape as pretty much everyone else. You're not going to fall you're not going to fall behind your peers if you're able to just keep doing your schoolwork and do it this way. And this another thing I'll remind these families is that compared to the spring where it's in March, it was like this happened and boom, everything shut down, and folks were scrambling to try to get a system down. We've had that situation. We've had the summer to develop other ideas, and the teachers, while it's not ideal, and I know they'd love to be back in the classroom with the kids, they've had some time to see what works and work out a better structured system for teaching the kids. So that's another thing that can help them a little bit. Just remind yourself, it's not going to be perfect, but the teachers are on top of this, and do your best and seek for help, seek some assistance even for the teaching stuff if you need to. Now, if you're getting mood symptoms getting really rough, I mean, there's options. There's, again, the crisis lines. There's, if it's not too bad, you talk to supportive friends and family, maybe even some school staff. I think the Fayette County website even listed some stuff there with their youth centers. Primary care office has some references. Of course, the hospitals, I mean, there's emergency rooms and psychiatric inpatient stuff. If it's not quite that bad, I mean, most mental health clinics are available online. Throughout the state, there's community mental health with New Vista, 7 counties, Pathways, Comprehensive Care. We've got KDC, where I work, has sites throughout the state, and they do some intensive wraparound services with the therapy, case management, and psychiatry. And again, the online resources are helpful too.
Well, thank you for covering everything so thoroughly. I appreciate it, especially since I sprung some of those questions on you.
Oh, sure, that's fine. It's hard to be super thorough because there's so much going on right now.
Yeah, there is. It's a lot. It's a big topic, and we knew that. Anybody else have any more questions? We're gonna give people just another minute here. See. I'm not seeing any. If any come in later, I'll make sure we get those addressed. But thank you so much, Dr. Cruser. Is there any parting words you have for us?
Well, I appreciate Mental Health America having this opportunity to try to come up with some ideas to help the community there. and to advocate for mental health needs for so many of us. And for these families, just remember, take care of your own basic needs. Seek help when you need to, and just model that for your kids. And just let someone know if you need some help, whether it's through frustrating situations or the teaching or whatever. Just be open to that, and I think that'll help through a lot of it there. And be patient. Let the kids know this is temporary. For them, I mean, 3 months is like a huge part of a lifetime. You guys know better than that. But so just let them know, okay, this is going to settle, and remind yourself, okay, this is not permanent, and just, it's really frustrating right now. But just to remind yourself, okay, it's going to chill after a while. Just, you got to make it through. You can do it.
Good points all around. If anyone needs assistance finding help, please come to us at MHA Kentucky. We're always happy to do that. We're at 859-684-7778, or we're always available at mhaky.org. So folks need that. There's a Get Help tab that can help you self-help, but you can always contact us as well. You get personal assistance. So thanks so much, Dr. Cruser, and thanks everyone for joining us today.
To my pleasure. Thanks guys for sitting in, and hopefully it was helpful for you.
Have a good one all.